It really is a privilege for me to be here this afternoon, and thank you, Dr. Dietz and Dr. Burnett, for your presentation so far. It really is on your shoulders and folks who have gone before me that I stand. I want to start out by telling you a story about my friend Jessica. I'll take you back not quite a year and a half to the first week of January 2012. Jessica Linares, not her real name, is a bubbly 9-year-old girl. She comes to the Upper Cardozo Health Center, my place of work, with her mother for a well child visit, requesting a school form for a school physical. Not an unusual visit in my day-to-day existence as a primary care provider. Jessica and her sister Susanna, who's 10, live with their mother and father, who are originally from Honduras, in an apartment in Northwest Washington. Dad works as a custodian. Mom is taking English classes and is expecting a third child. In the course of her visit, Jessica's doctor reviews her growth curve, a crucial part of the visit, of course, along with assessing her life and relationships at home, at school, other aspects of the history and physical examination. Then our electronic medical record automatically calculates her body mass index. And here's a picture of Jessica's BMI over time, with on the far left from her 2-year-old well visit until on the far right this visit in January 2012 when we meet her. So hanging out around the 95th percentile, and here again, as between her second and third years of life, the BMI is creeping up over the 95th percentile. So what's a primary care provider to do at this moment? It's, as Dr. Dietz alluded, it's not easy. There's a sense I often feel of my lack of self-efficacy. What can I do in that 1 minute of the visit that I have at the end to try and address this issue? It can feel daunting, to be able to not only raise this issue in a sensitive way, using appropriate terminology, but to counsel my patients and their families, and also to guide them in self-management regarding healthy nutrition, activity, and weight management. So it's a tough conundrum. Here's a picture of Upper Cardozo Health Center where I work. We see about 400 patients a day, and this is a conundrum that we face every day. About 40% of our children between the ages of 2 and 18 are either overweight or obese. Actually, a little more than 40%, 25% are considered obese. We're part of Unity Healthcare, which is a network of 30 health centers around the District of Columbia. We serve more than 100,000 individual patients, so almost 1 in 5 people here in the district. And at the particular health center where I work at Upper Cardozo, we see about 22,000 patients. So there are a lot of other kids like Jessica and families like her family. And most of them come from, the parents at least, from Central America, El Salvador, Honduras. So as I'm trying to paint, as Dr. Dietz alluded, the clinical setting can actually be a really challenging environment to address obesity compared to the great strides which we've really made in public health. But here we are today trying to figure out what can we do in the healthcare environment to accelerate progress in obesity prevention. Here's a glimpse of our neighborhood, Columbia Heights. It's, as those who know DC, it's one of the more ethnically and now, in recent years, economically diverse neighborhoods in Washington, D.C., replete with row houses, older apartment buildings, condos, and a great deal in recent years of commercial activity popping up. So healthy weight in our setting is not always a fun topic to bring up. It's not always on our patients' minds. When we providers are not equipped with appropriate terminology, we have a sense of self-efficacy. We tend not to like confrontation, just to stereotype a little bit. It can be tough, especially when you're trying to establish and maintain a rapport with your patients and families through their years. So in this final visit, must I confront her? There's so many other issues I'd rather address. The fact that neither of her parents has more than a 6th grade education. I want to make sure that she's doing well in school and moving on toward college. Really, it would be nice if I could offer something else, especially when it feels like there are so many other forces, large-scale social forces working against me as a primary care pediatrician. One of them being the fast food and junk food nation. This is a recent cover picture from New York Times Magazine article by Michael Moss, who recently wrote a book salt, sugar, fat, with a quote, "I feel so sorry for the public." That was from the former chief scientist at Frito-Lay, when he was considering his industry's assiduous work to create and keep marketing and selling cravings for junk food. He may as well have said, from my perspective, "I feel so sorry for the pediatricians." Sugar-sweetened beverages are another issue, certainly I won't go into, but a great big factor we're up against. Nature deficit disorder. Children today are taking in unstructured outdoor time at lower doses than ever. Certainly when I was a kid, and I'm sure when many of you were children, we had plenty of unstructured outdoor time. Whether you're in the city, whether you're in the suburbs or in the country, it's much less common these days. And finally, there's a great deal of marketing toward especially rapidly growing groups such as Latinos, whom I serve at the health center. So if this problem of obesity is so multifactorial in its origin, of course, surely a multifactorial intervention will be necessary, even in the primary care setting, in order to address it. So in 2008, 3 physician assistant providers, and I mentioned that they're physician assistants, they've been fantastic at our health center, led by Ms. Jessica Wallace, adopted the evidence-based WeCan, or Ways to Enhance Children's Activity and Nutrition curriculum put out by the NHLBI and 3 other institutes of the NIH. The curriculum's available at no cost. We were attracted to that. And we started offering sessions with families in the evenings. And over the course of the past 5 or so years, we've learned from our patients, engaged, and been able to adapt this into a weekly, every Wednesday night, including last night, we meet for 2.5 hours with a group of patients. And we have several components to that visit. One is we assess the BMI, we review health knowledge and behavior, we have unstructured play with healthy snacking as part of every visit, and often we make healthy food. We have a WIC office, the Women, Infant, and Children Supplemental Nutrition Office, in our building that has a demonstration kitchen, so often we get the kids and their parents engaged in making food, and we offer healthy activity. Who comes to the WeCan visits? You can see this is a unique thing about our effort, is that it's people of all ages. While the majority are kids between 5 and 15 years of age, a large plurality are adults. And so having physician assistants, family nurse practitioners, and providers, including internists, family physicians, along with pediatricians, it's nice to be able to engage all of them at these visits. And a very unique set, I think community health centers offer a very unique opportunity to be able to engage the entire family. So typically we offer a healthy snack during some unstructured playtime at the beginning, usually a veggie tray, something along those lines that families can snack on, while each of the other families is having time with one of our 2 or 3 providers there, usually on Wednesday evenings. We also have healthy activity. You can see a guy in the back, that left picture, who looks like he can't dance. That's me, but wearing a t-shirt, and I have a picture of the t-shirt there in part because on Wednesdays when we do the WeCan program, providers, medical assistants, and staff who are involved in the WeCan program will actually wear these t-shirts in part to engage our patients and the rest of the staff in our efforts towards healthy lifestyles. And you can see some healthy greens there that just in the recent weeks one of our providers got going in our small plot in front of our health center. Here we are making a healthy salad together in the WIC demonstration kitchen at our health center, playing pickup soccer at a local park that we walk to frequently. That's just 5 blocks away or so. We'll take patients and their families on field trips to the grocery store, give them a few dollars to buy a vegetable maybe that they've never tried, to also buy a snack that's 100 calories or less and has 3 grams of fiber, so trying to teach folks how to read labels. It's been crucial for us, even in the primary care setting, to get out of the health center and into other environments, the food and beverage environment, into the physical activity environment. So how many times do people come? You can see the plurality, over 40% come to just one WeCan session, but a good chunk, if an equal amount, come to between 2 and 10 sessions. And we really start to see benefits for those patients who come between 2 and 10 sessions or more. In 2010, we had about 584 visits that year to the weekend program. 2011, about 800, and this past year, about 1,300. So how do we know that this change and this intervention leads to improvement? I go back to our friends at the Institute for Healthcare Improvement and Associates in Process Improvement and the improvement model. We have to ask this question: how do we know? With all these tools at our disposal, beyond the stethoscope, beyond immunizations, prescriptions that we typically have in a visit, how do we know that we're making a difference? Let's go back to our friend Jessica, to whom I introduced you to. And this is actually her making kale chips in the WIC kitchen. So here's Jessica's BMI. Since that first visit in the top left, where her primary care provider said, hey, I really think your family should check out our weekend program, she's really made strides and come down about 10 percentage points in her BMI percentile. And she's not exceptional. This is typical. For those who come to multiple visits, we've been able to show in preliminary data that their children's body mass index percentile will go down almost 0.2 percentile points with each additional visit over time. So we're really starting to see some successes. Actually, with adults, we have been able to show that their weight goes down with each successive visit. So some of the learnings and challenges, as far as things that we've learned, we're standardizing practice among our healthcare providers. I mentioned the BMI gets automatically calculated. That's something we didn't have the luxury of, and certainly wasn't the case in the earlier BMI measurements in Jessica's well-child visits through the years, in part because it wasn't automated. That's helped, and certainly we have a template that we use where we ask at each weekend visit about healthy behavior, about healthy activity, and health knowledge. Every single one of our kids, once they've been coming at least a few times to our visit, can tell you how many spoonfuls of sugar are in a 20-ounce bottle of Coke. About 16. But we ask that every time and really standardize the way we do things. And WeCan has transformed not only our patients but also our staff. Our medical assistants and providers have really become engaged, and we're able to bill for these visits. Almost all of our patients are under Medicaid, and we're able to bill with no co-payment, which really reduces barriers for patients to be able to come in, and also allows us to be able to offer the service on a regular basis. There certainly are challenges for us as well. As I mentioned, Unity's got a number of other health centers around the district. Each has different population, different needs. As a federally qualified health center, where our primary role has been direct patient care, we're relatively underdeveloped in comparative effectiveness research and biostatistics capabilities. I do want to, in my last moment or two, tell you about some new directions in which we've engaged recently. One is the Fruit and Vegetable Prescription Program, which is a national program that is led by Wholesome Wave, based out of Connecticut. They've partnered with a number of centers around the country, including ours, and DC Greens is another of our partners. They're a farmers market partner here in DC, and this is actually a picture of the market right in Columbia Heights on Saturday mornings with whom we've partnered. But we had last year 35 children who were either overweight or obese, and their families got $1 a day per family member per week from May to November for the whole farmers market season. So if you've got a family of 5, that's $35 a week that you get vouchers to spend purely on fruits and vegetables at the farmers market. So we would do field trips on Saturdays, actually introducing our patients to the farmers markets. And it's been real exciting. We're continuing that this year and have expanded it to one of our other health centers as well that's going to engage 10 families this year that just started. We actually had 70 people show up to our visit last week, our weekend visit, in part because of the Fruit and Vegetable Prescription Program. And lastly, I'd like to mention the DC Park Prescription Program, which we're getting ready to launch later this month, led by one of my colleagues, Dr. Robert Czar, the immediate past president of the DC chapter of the American Academy of Pediatrics. He and his team have worked over the last couple of years to systematically rate 200 so far of the 350 parks around DC. 20% of DC is green space, and it's arguably underutilized. So the goal here is that physicians and providers such as myself will be able to prescribe a park page to patients. You know, this is the park page on the right here of the slide for that park where we were playing soccer at one of the weekend visits, but that talks about cleanliness, accessibility, exercise level, and so forth. So I'm really excited to see what happens as we roll that out. I'd like to acknowledge the efforts of my colleagues, Jessica Wallace, Robert Czar, and other providers in our weekend program. Myrna Valdez, our patient registration clerk, who has really become more of a community health worker and outreach worker. She really gets the people to come and calls them often to remind them to come. Our medical assistants, to our management team and leadership team. Really thank you for your attention, and I look forward to the discussion coming up.
So we're going to have about 10 minutes of discussion among ourselves, and then Eduardo's going to come up for the town hall discussion.